Name is Rizwana Azam Khan. Today I am presenting my presentation about the human immunity. I have three sections. My first section is about uh, the non-specific defenses against the diseases, and then describing the first and the second line of defense, and then specific examples. So first of all, non-specific defenses. What are the non-specific defenses? Non-specific defenses are those which do not differentiate between the type of the pathogen or another, but show the same response to all pathogens. So, and non-specific specific defenses have there are two kinds: first line of defense and the second line of defense. First line of defense consists of physical and chemical physical and chemical barrier, which include the mucous membrane, mean the saliva in our mouth, the gastrointestinal system, nasal cavity and airways, urinary tract, and the examples. So I want to discuss a little bit and brief discussion about these topics. Mucous membrane is mucous membrane over the area of eyes, ears, nose, sinus, mouth, throat, and gastrointestinal tract, respiratory tract, and vaginal tract. These are the area of the mucous membrane. And basically what it did, mucous membrane are covered with the secretion that fight pathogen and form an effective defense against the infection. My second is gastrointestinal system, the digestive tract, including stomach, pancreatic enzymes, bile, and intestinal secretion. And basically what they do, they gastrointestinal tract, powerful acidic and alkaline secretion act to protect the system. The third is the nasal, the important in the nasal cavity and airway. So microorganisms that enter the body through the nasal cavity become stuck the mucous lining the interior of the nose, then removed by blowing or the nose or throwing cough. And the urinary, next is urinary tract. Urinary tract, basically the I want to ask, the skin plays a very important role during this infection through the the barrier of an infection. The skin is basically made up of epidermis, we all know, dermis, and subcutaneous layer. So example, like first of all, this part I want to add is example of skin. Skin has waterproof mechanism barrier in the body's first line of defense against infection. The skin is physically stop most pathogens such as environmental toxins and epidermis. So it's like it's also prevent entrance of the micro biological organisms, prevent chemical irritate, prevent water loss as well. So now I want to discuss my second line of defense, and which and I'm giving the examples. The cell, the diagram shows the neutrophils, eosinophils, basophils, platelets, and macrophages are the example of that. But I want to discuss only one because I have short time, so I just give a brief as the diagram shows. Macrophage migrate from the blood vessel to infected tissue, and they engulf the foreign particle and microorganisms. And the most important, neutrophil engulf foreign particles and microorganisms. The other example is its inflammation role of macrophages and the other things. I just little want to discuss the inflammation, like injury to the skin or infection will sometimes cause an inflammatory response. The inflammatory response is the collection of the cellular event that is a major component of the innate immune system response to the damage to the infection. I also want to discuss a little bit about the histamines. They also have the power to change the permeability of the blood vessels and make it easier of cells that help in the healing process. And the other, when I discuss the macrophages, role of macrophages, basically they are specialized cells. They are recognized, engulf the ultimately destroy target cells. They prevent infections. They are present in high amount in liver, lungs, kidney, and the other thing, and basically they macrophages, they present in the mouth. They process macrophages engulf the foreign material, and also they contain digestive enzymes which broke down the foreign material. So this is my first section completed. Now I'm coming the section 2, specific immunity. Third line of defense: self-recognition and tolerance to have on rejection and transplanted organs to specific immune system. So my first question is about third line of defense. It basically it consists of acquired immunity, the acquired immune system, which is consists of T cells and B cells and immunoglobulin, which is antibiotics. So first of all, explanation of the third line of defense. The third line of defense involves the first and third lines of defense. It constates a specific response for each specific pathogen, resulting in adaptive immunity that is medicated by specialists. So what is basically acquired immunity? Acquired immunity is basically a learned response from the body's immune system, and the best way to damage each antigen. So it has basically two types, actively and passively. Actively mean in which the body is intentionally exposed to a foreign antigen, to a vaccine, and passively by introducing preformed antibodies and generate a protective immune. So what is the rapid response? So rapid response, when the immune system identifies a foreign antigen, it motivates the body to produce antibodies and attack and destroy the specific antigen. So how it different from natural acquired immunity? The difference between natural and artificial acquired immunity is that artificial immunity involves human interventions, whereas the natural immunity is without of human inventions. Now the body immune system start fighting with the disease causing agent. So agent, and it gives protection to the body from the disease causing agent. The next is the immune system cells. The immune system cells, the leukocytes are the most called white blood cells. They play an important role in human system and involved in defending the body against infection in the foreign bodies. So they are what are basically their types? They are neutrophil, lymphocyte, monocytes, eosinophils, and basophils. So the acquired, so basically, what are the T cells? The acquired immune system. The second part, the acquired immune system. The acquired immune system in human is responsible for the destruction of pathogen. So it consists of two cells, basically T cells and B cells. What is the T cell? I'm just giving the very brief introduction. Like T cells, they are mature in the thymus gland. There are three types of T cells: cytotoxin T cells, suppressor T cell, and helper T cell. All these three types of T cells play a role in the destruction of the not normal cells in the body, and they have several key roles, like the signaling for growth and activation. The activation of the cells can't eat foreign substances, stimulation, and the etc. So the next is the B cell human immunity. B cells account for 10 to 15% of all lymphocytes. When B cells release many antibodies, then maturation take place in bone marrow in human being. So basically, what is the role of the B cell? So B cell, they produce antibodies, providing antigens to T cell and giving signal to the T cell. And the most important, their work, their example is plasma cells. They produce and secrete antibodies. These antibodies are secreted into the circulatory system. Now my third question is immunoglobulin antibodies. So what is immunoglobulin? They are protein. Basically, they are protein. They have connection to the antigens. Antibodies have many uses like within the body, including targeting the infection, neutralization of toxins. The example you can see, like they have the 5 types of their which is GAEAMED. So these are the example of these, and their function is in the second most. The first is IgH. IgH the most abundant immunoglobulin. They can stimulate a very direct attack on anything. And the second, IgA is the second platinous, like it exists, it present in mostly uh, one major her role is it gives cellular protection of the soft, moist mucous surface of the body, and the other is the IgM. It is the first. It produces an antibody response. IgE. It's a favor. Hay fever is a condition caused by too much IgA activity, and the last is IgD. This is the comparatively unknown molecule. Its main function, the immune system remains unknown. So these are this is my second and my the third question of this is antigens, self-recognition of self-organ, tolerance to its tissues, and transportation and rejection of the. So antigens, what is the antigen? Antigen is a molecule which are the present on our the cell to distinguish between the self and non-self immune system is because of the unique nature of the antigen and allow only the non-self to be attacked. The two important factors in immune system is MHC1 and MHC2. So basically, the immune system is not when the immune system encloses the antigen of red blood cell on the surface, it will not attack, and the antigen is recognized as itself. So when the human immune system encounters, and it has been seen before, this will be recognized by non-self and innate immune system, and the adaptive immune system B and T cell response will show now. So basically, the importance of sensitivity of the antigen, the immune system not having the same level of sensitivity of to all antigen. First, it's hypersensitivity and the failure of self-tolerance. So hypersensitivity is an abnormal immune reaction. This is caused by the immune response to repeated experience to the same antigen. The failure, when hypersensitivity diseases are grouped into the major categories, the group are immediate antibodies, immune complex, and the cell medicated types. So these are the brief answers. My next, like you can see, the describing two specific immune system disorder. There is a rheumatic arthritis. The diagram show this is the transplantation. So transplantation, what is the mean? Transplantation is the transfer of the human cells, tissue or organs from a donor to recipient. For example, kidney, liver, a heart, by replacing the damaged organ with a healthy one. The rejection, what is the rejection of the translation? Rejection means that someone body's knows, then the transplanted organ of the example kidney is not its own and fight to react, and the rejection of transplantation changes from patient to patient. Rejection may be either chronic. Fortunately, there are some treatments that can help to prevent rejection process. So basically, what is the transplant rejection? When a person receives an organ during transplant surgery, the person immune system and may that it foreign because of the person immune system detects, then the antigens of the cell organ are mismatched or matched. The organ that are not matched or the and then these will be rejected if they are not matched. So basically they have the three types of the rejection. Like acute rejection may happen anytime, chronic rejection is a long mean take place several times. The body considers immune response slowly damages and transplanted tissue or organ. So my next this is the diagram which show the the joint. You can see the rheumatic arthritis and it's a example. So I'm discussing this is the two examples. So lupus and the and rheumatoid arthritis. So what is this lupus? So first of all, rheumatoid arthritis and lupus, commonly severe disorder, both condition and the diseases. So both conditions are autoimmune disease that occur when the immune system mistakenly attack part of the body. For example, once the disease is triggered, immune system migrate into the joints, and they produce a large quantities of the immune medicators. For example, antigen presenting cells interact with T cells to cause the production of the immune mediator which activate more cell. For example, T and B cells produce self-reactive antibodies to immunoglobulin, which can be used and diagnostic and prognostic marker. So basically, inflammation can vary in severity between patient, but it's but it's chronic and progressive in nature, leading to the joint and damage of the. My second example is lupus. So lupus is a long-term condition that causes a joint pain, skin rashes, and tiredness, and there is no cure, but symptoms can improve if treatment starts very early. So what it's a symptom: joint and muscular pain, extreme tiredness with no go away. That will no go away to matter how much you rest, and rashes, and you can also have headache, mouth sore, hair loss, and this one. So my third and last section is the categories of acquired immunity. So, the third section, I'm discussing active immunity. Active immunity. There are two types of active immunity: active natural active immunity, artificial introduced active immunity, and natural active immunity. They are a type of immunity develops from the pathogen that causes the specific disease. When an infectious organism like a bacteria or virus enters the body, it will try to attack the pathogen. The artificial induced activity mean this involve an individual being artificially and intentionally exposed to the foreign antigen to generate a protective immune response. So antigen in the vaccine cause a reaction in the immune system, stimulating it to produce antibodies and memory cells. So passive immunity, it has two kinds: natural passive immunity and active passive immunity. Natural, in this process, antibodies are transferred from one person to another through the natural method. And the artificial immunity, passive immunity, is safely developed by giving a person injection and transformation of antibodies made by someone. So my next is um, it's immune response to a vaccination. So it consists of immunological memory, primary response, and secondary response. And what is immunological memory? Immunological memory means that the previously activated antigen in the memory of the immune system and create a strong and powerful reaction when facing the same antigen. So what is primary response? When a pathogen is encountered for the first time, it takes time for the antigen to be identified by the B lymphocyte. The antibody is produced by the plasma cell. Second is it's in the same pathogen in encounter the second time. So it is like same the memory cell and identify the so vaccine and immunogen. Vaccine are used to initiate the production of the memory cell without causing infection. It's a live vaccine. Live vaccine are derived from the wild or disease caused for virus, bacteria. To create an immune response, live vaccine must repeat in the vaccinated person. So inactive vaccine are vaccine which are produced by growing the bacteria or virus and therefore this vaccine cannot be cause disease from infection. So my next topic is the benefit of vaccination. So you can see the measles infection is from 1940 to present day. The immunization and vaccination give protection to the immune system, as you see in the chart, against the serious disease. So against the serious disease. Viral disease cannot be cured and can be controlled by immunization. So the below chart shows measles notification and death rates in the England and the Wales in 1940 to 2000. As you can see, notification, if you can see easily, between 1940 and 1968, average between 2 per annum will peak every 2 years, and around 100 deaths from acute measles immunity. In 1968, so the next is My next question is herd immunity. So when many people in an area are vaccinated against a disease, few people can get vaccinated. This is because few germs to transmit from person to person, therefore the disease quickly disappears. And my last is the benefit of COVID immunization. My personally opinion, immunization is very good because it helps, like it's a COVID. When I vaccinated, so we can prevent the other people. So this is very good. I totally उफ, ये